We go to item number 6. It's an update to active grant Billy Clark, DFL Associates. I think it's
Good morning, Billy Clark, DFL Associates. The 3 programs that we are managing for the county all relate to our primary target is the middle and high school ages. So before I go into the specific reports for the 3 programs, I thought it might be helpful just to give you a higher level view of what the youth reported in the Youth Risk and Resiliency Survey, just a very high level summary, because we take that information and then use it in our programs. So overall, for those who don't know, the Youth Risk and Resiliency Survey is administered in the schools in odd-numbered years, and it's a statewide effort that meshes with a national effort. So just a very high-level summary is that New Mexico as a whole revealed a couple of encouraging trends. So overall, there were declining rates of suicide ideation and attempts. That's at the statewide level. In Torrance County specifically, we rated significantly higher than the rest of the state for young people who feel persistent feelings of sadness or hopelessness. So that can tie to a lot of different areas. Alcohol use in general is decreasing or has kind of stabilized. However, for New Mexico rates higher than any other state in the country for young people who are drinking before the age of 13. Tobacco use in New Mexico has declined, although in Torrance County we're seeing a little bit of an upward trend, and particularly around spit tobacco. And then behaviors associated with violence have declined statewide, but we're seeing an increase in middle school students who are reporting bullying. And part of that is that we're creating greater awareness of what bullying is, but they've only been looking at the middle school kids for the past 2 years, so it's kind of hard to say if there's any definite trends. So I think I kind of covered all of the highlights of that, and I'll get into our specific programs. So the first is our Adolescent Pregnancy Prevention Program, which is known as TOP, the Teen Outreach Program. This is one where we've had some, as I understand, some questions about why it's in Estancia. And to be quite honest, it's in Estancia right now because they have just opened arms, welcomed us, provided a place to meet, and we provide community service in exchange. Our intent moving forward is we've had 2 years in Estancia. Mountain Air has expressed to us that we probably won't get enough young people involved to have it there. So the last 2 years of our contract, we would very much like to have Moriarty serve as our club, because we have to have a club of 25 young people at a time. And the reason that's important is that there's very much a community service component, so they need to be attached to that community. If we try to spread it out and have 6 or 7 people in a community, that's not really enough to sustain it and build upon. So we would ask for champions in helping to find a place in Moriarty moving forward. We know that there are transportation challenges, and it's not an easy sell in the community because it is comprehensive reproductive health, and that means we do have to talk about sex. We do have to. They actually have to visit a public health office and have demonstrations around various forms of STI prevention and birth control. So that's kind of what we hope to do moving forward, and a little bit about the program. So specific to the program in Estancia right now, first of all, I'd like to give all credit and thanks to Rebecca Cummings, our facilitator there, and our dear Salvador Alvarez, who is not with us now due to a recent medical emergency, and he is greatly missed. But currently there are 25 people enrolled, which is the maximum. We are offering it 4 days a week so that young people can come when they choose to, because it's out of school and voluntary. So at any given day, we may have only 7 kids, but it's different 7 kids coming each day. So far, they have contributed almost 375 hours of community service. They manage the monthly food pantry program that the town of Estancia sponsors. And so they're serving 100 to 150 families each month. And that's not just people from Estancia, people from other areas are coming to participate in that. Young people receive a stipend in the form of a gift card for participating. They have to participate in both lessons and community service. And so far, we've awarded $1,340 to young people in this year for their service and participation. Any questions on that program before I move on to the next?
Ms. Clark, I do want to comment that you had sent a report and that you requested for Moriarty if we could find a place, and that is in the process. I've been speaking with the mayor and some of the school board. So at a later date, I may ask you to come in and present exactly what some of the questions were. Do you give condoms away? And the questions that I could not answer, but
Okay.
these are questions that people have,
Yes.
you know, that you may be a lot better at answering.
Yes.
If we can arrange it.
And thank you, and I'd be happy to do that. And one of the components that I didn't mention is there's specifically a parent training. I mean, research shows that young people would prefer to be speaking to their parents directly about this, and we offer a training to help parents recognize those teachable moments so that they can impart their own values. So just because we are presenting comprehensive reproductive health doesn't mean that we're trying to say what those values are. And we would love if more parents would come on board and just be comfortable with talking about this with their own children and presenting their own values. So I'd be happy to answer those questions. And no, we do not give out condoms.
Good.
Any other questions? Okay, so moving on to drug-free communities. Drug-free communities is a coalition, broad-based coalition, working to, our primary target is, again, middle and high school ages. But, we work with other groups, working with adults, such as the DWI Court Panel. We work very closely with the DWI program, and in our funding application, you may recall seeing that a good part of our match is in-kind services from the DWI program and other county staff. Just a couple of highlights for our program are that the YRRS data that I just gave you a very high-level summary of, I've done much more in-depth with the Mountain School District, which specifically requested that I help them with that. Just so you know, anyone can access county-level data, but data specific to school districts has to come through the school boards, so I can't access it without their permission. So far, I've helped the Mountain School District, and they have taken that and presented it to their school health advisory council, and then for a parent night. In the Estancia district, I was able to coach them on how to present it, but they weren't comfortable releasing the data outside of their district. And Moriarty, so far I haven't seen their data. I did make one email request to the superintendent to see if I could be part of their school health advisory councils, but they're structured differently, so I haven't had any feedback and have not been invited to participate. We just sent 2 people to the CADCA National Leadership Forum. That's the coalitions, the anti-drug coalitions of America, basically. And so they have come back and will be reporting to us this month. That was just earlier this month. At the DWI Memorial, where we are housed, I just want you to know that Lieutenant Insenius from the Moriarty Police Department every few months facilitates a DWI Victim Impact Panel, and she just did one of those in January. Valencia Counseling Services uses the memorial to conduct court-ordered DWI classes, and they do that every other month. So they'll be back again in March. They were there in January. And I already talked about YRRS and SHAC. So a couple of the things that we're working on are to take youth input from the Youth Leadership Summits that we've held in the spring and fall of each year. We've recorded different snippets, discussion, dialogue, and now we're getting ready to put that into a usable format so that we can have Youth Corner radio programming on the radio once they're beyond the testing phase. So we may take some comment that a young person has made at one of the summits, and by the way, every young person who participates has immediate consent from their parents. And then we may build a discussion around that with other young people in the community so that they're talking about issues impacting them and hopefully positive solutions or, what we might do with those issues moving forward. We are working with CYFD and a host of others to sponsor and help coordinate this year's block party and health fair. That's a fairly big event now in Moriarty, and last year I think they had around 300 people. So Drug Free Communities is actually paying for the facility, and we're donating a lot of time to help coordinate it, and we'll keep you posted as that unfolds. This month, we're partnering with NAD, Mothers Against Drunk Driving, and the DWI Memorial to have a table at the Roundhouse on February 20th, which is DWI Day. I know Tracy Master will be there with her program. Then in the summers we've been having Teen Fests the past couple of years, but we found that at these Teen Fests, which had been here at the fairgrounds, that it really turned out to be family events. So this year we want to do, and Tracy had this great idea, Tracy Master, that it be more of a sober fest, and that we try holding it in Moriarty this year, and have it be on the weekend instead of a weekday, and late afternoon, early evening, so we could just make it, we could showcase some of the young people in the communities, what they're doing, and hopefully their parents will come and their families. We might have some dancing. And also just create awareness about the issues around social hosting and providing alcohol to minors, since Moriarty and Estancia have included social hosting language in their public nuisance ordinances, and I know the county is considering that. So that's kind of an update of what we've been doing, drug-free communities. And when I say drug-free communities, and if you hear of the Substance Abuse Prevention Task Force, it's the same. So I'd be happy to answer any questions about that.
Commissioner Duffy, you have any? Commissioner Ferber?
I have them.
Thank you very much. If that concludes your...
Nope,
okay,
one more.
One more? Okay.
So the last is the Juvenile Justice Board. And when I came before you last time, I presented the funding application, and I apologize that it came so quickly. That's kind of the way it came to us, and I know it was a lot to digest. But I wanted to just update you on some of the accomplishments where we stand and what we're in the middle of right now. So we went from the planning and assessment phase. Now we're rapidly in the developing programs and getting them going phase. So, and that has been a trip. It's not easy. So the Youth to Work Employment Mentorship Program, because I know that that's important to everyone. From the period of the first year we had it, it was a total of 22 youth served. That was 12 males and 10 females, 14 Hispanic, 8 Anglo. The KEYS work skills curriculum was utilized, and they were from all areas of the county. The group that we currently have on board, first of all, we lost our mentor. We didn't lose our mentor, but I mentioned the medical emergency that he had in January. So we had to regroup, find a new youth employment mentor, and kind of get back on track. So we had a gap in service right there. So far since we started in June, we've had 16 youth enrolled. 7 males, 9 females at this point in time. And they reside in Edgewood, Moriarty, Estancia, and McIntosh. We've had some recruiting challenges in Mountain Air. And I don't have a current number of who's completed what, because we're trying to reconnect with them. Where we were kind of absent for a month, we lost contact with some of them, and we're rebuilding that, but on track. Jen Honorheim is our new mentor, and she is pounding the pavement, trying to reconnect with young people and their families to get them back on board. So we mentioned, the county manager mentioned the issue with Calvary Chapel. Calvary Chapel was very gracious in extending that service to us as a temporary reporting and assessment center. The only issue is that we had limited access, and we discovered that the truancy response team couldn't meet at the same time that we had access to that building. And they're in the middle of construction. So the radio station is letting us temporarily meet there, and we're trying to see if their board will approve that so that we can utilize that as the temporary building, just so we have a place to meet, and so that our service coordinator can have young people come in there. So the things that we've made real progress with are that the truancy response team is meeting every other week. The 3 school superintendents worked to unify their compulsory attendance policies so that all 3 districts now have the same policies. And those truancy referrals, now the information going to parents is all the same. And what happens when it comes to the truancy response team is that every young person is assessed through the juvenile inventory for functioning that looks at 10 domains important to a young person's life. And it's something that the young people are taught. It's automated. So research suggests that they're a little more forthcoming in answering honestly when they're, I don't know if it's so much that we're so technology oriented now, but they are actually answering online. It's an online assessment tool. So from that, it'll generate a report so that the truancy response team can make recommendations for referrals to a host of services already available in the county. The other piece that we're developing is the juvenile citation program, which it's a diversion program to keep young people off of formal juvenile probation. So law enforcement can make a recommendation through the juvenile probation office, and then juvenile probation decides if they want that young person to come to this diversion program rather than formal probation. And that's the piece we're still developing. There are specific components, gender specific. There's a boys council and a girls circle. Boys council, we had a volunteer who has already been trained and is ready to go with that. Girls circle, we don't have anyone trained yet, but we're working on that. Teen court will be a part of the citation program too, but that's something that already exists. And community service will be part of it. So I think that's it in a nutshell. It's, we are pounding the pavement trying to get this up and running as quickly as possible because there are a lot of referrals specifically on truancy. So do you all have any questions about that? Alrighty then, and I will do better at keeping you all apprised because I realize we haven't done such a great job of that. So thank you very much.
Thank you, we appreciate it.